Hi, this is Dr. Marty Rossman from The Healing Mind, and I'm going to answer some of the questions we get from users of Healing Mind products and other people that are interested in stress reduction, anxiety reduction, good mental health, and mind-body healing. This person said, I've read your book, The Worry Solution, and consistently use your anxiety relief CD. I suffer from PTSD, anxiety, for 23 years, and I'm wondering if tinnitus has any bearing on this matter. I've been suffering too long from this ailment and have just about run out of various treatments. Thank you, Jim Hippel from Florida. Jim, I'm glad you've gotten some relief from the anxiety and from the PTSD. I'm glad you've put these techniques to work for you. Sometimes mind-body techniques work to reduce tinnitus, which is a ringing in the ears or a sound in the ears, often coming from exposure to loud noise, like gunshots or loud music. But sometimes we don't know what causes it, and it can be a very, very annoying symptom. Largely because we get locked into wanting it to go away, and it becomes like the old Brer Rabbit story with the tar baby, where the fox constructs a little fake boy out of tar, and when the Brer Rabbit comes along, and he says, "How do you do?" The tar baby doesn't say anything. And he says, "I said, how do you do?" And the tar baby doesn't say anything. And he gets very mad and he punches it. And when he punches it, his hand gets stuck in the tar. And then he punches it with the other hand, and that hand gets stuck in the tar. He kicks it, gets his foot caught, and kicks it again and gets his other foot caught. And then the fox takes him away with the intention of cooking him for dinner. So when we get in a mental battle with tinnitus or any of these symptoms, insomnia is another common one, we get locked up in it and can't escape it. And so, in a sense, we want to learn how to back up and disengage from it, or put some distance between us and it. And there's an exercise called the observer exercise that I teach in a lot of my courses and on my CDs, where you do learn how to notice the symptoms that you've got, and yet notice that there's a place you're observing them from, and you have that platform that doesn't allow you to get so stuck in the battle. That in itself is a helpful thing. Deep breathing and mind-body relaxation, physical relaxation, can help. And one of the most helpful things with tinnitus, and I'm sure you've tried a million things, is to let yourself know that it's not a dangerous signal. There's nothing really wrong. Your brain is just paying attention to this signal, and that it's not harmful, and it can be in the background and go away. Just like if you move into a house or a place near the railroad track and you hear the trains coming by periodically, and they're very, very bothersome. You want them to go away. But your nervous system generally accommodates to that over a short period of time. And the train still comes by and may blow the whistle, but you know it's not a dangerous signal, and you just let it be in the background of your awareness as you continue to focus on other things. You can also, of course, consider using techniques like the ones I teach in my Guided Imagery for Self-Healing book and audio program, where you consult inside with a wise part of yourself, or you do a technique that I call listening to your symptom, where you allow an image to come for the tinnitus, and you have kind of an inner dialogue, an imaginary conversation with it, just to see if there is some purpose, if your brain is sending you a signal that it would be good to listen to, and find out what it is that it's there for, what it's trying to do for you. Sometimes, as a matter of fact, often, symptoms are an attempt of the brain and the body to get your attention in order to get you to pay attention to something that actually is in your interest, but that for various reasons you might not want to pay attention to. So that's a few different ways to approach this, and I wish you luck, and let me know how you do with that. The next question is, hi, Dr. Rossman. I love all your videos, and your calming voice, guided imagery, has helped me through a lot of anxiety. I'd like to know if there's a special process to help deal with grief, specifically the loss of a loved one, and the changes it brings along with the emotional and physical pain it causes. Thanks, Joni Harder. Well, Joni, to begin with, my condolences for your loss. Grief hurts. It's the cost of love. There's no easy way around it. If you have a spiritual life or belief system that brings you comfort, that, of course, is where it comes in very usefully. If there's a community you're part of, being with people that knew you and your loved one who you've lost can be very helpful. Ultimately, though, it's a process of healing that takes time and adaptation. If it makes sense to you, guided imagery can be very useful because a lot of times, part of the grief at least, is that we haven't completed what we feel like we want to complete with the loved one that we've lost. And guided imagery gives you a chance to do that. You can imagine communicating what you want to communicate to that loved one, even though they're gone. In your mind's eye, you can still imagine them, see them, even hear them. You know what their presence feels like. You can imagine being with them and honestly communicating whatever it is that you wish you had said or communicated when they were alive. If you're comfortable with it, you can even imagine that they communicate back to you and see what they have to say in response to your communication. Sometimes this will bring up more grief as you think about your loved one, at least for a little while, but very often it's soothing. It allows you to continue to pick up the threads of the relationship that may have not been completed, where you didn't get a chance to communicate what you want to communicate, and ask questions that you'd like to hear back from your loved one. Now, can I say that actually is your loved one in some other form? No, it might be. But it allows the communication to proceed and for the relationship to continue to grow and heal within you, which can lead to a lot of healing. It still takes time. It still hurts. But it's a very useful technique that I've seen help many, many people. Dr. Rossman, thank you for sharing such valuable information. Is there a tip on having patience while under stress? Maria Lozada. Well, that's a very good question, isn't it? Because we feel so pressured when we're under stress. We want things to happen and happen quickly. If other people are involved, there may be conflicts and conflicts of interest involved. So I think the main tool here is being aware that you want to bring patience into the situation. B, use your breathing. Practice your abdominal breathing. Slow your breathing down. Let your out-breath be longer than your in-breath. And use your breathing to modulate the intensity of your stress and feelings and bring it down to a more manageable level. Your breathing is a tool you can use to bring down that level of anxiety, stress, and impatience, and allow yourself to be with things that are stressing you in a calmer way so you can tolerate them over a longer period of time, which you may need to. There's a wonderful guided imagery technique that I teach in the Worry Solution and also on my Anxiety Relief CD. On the Anxiety Relief CD, it's called evocative imagery. In the Worry Solution program, it's called best quality imagery. And what you do is you identify a quality or qualities that you want to have more of. In this case, it would be patience. And you go into a relaxed state through your breathing and muscular relaxation. Go to your safe, beautiful place. And imagine a time when you did have that quality and you felt that quality inside you. If you haven't had that experience, you imagine a time where you've witnessed somebody having, for instance, incredible patience in a difficult situation. Or you can imagine what it would be like to feel like you have patience in that situation. And then we go through a process of actually feeling what it would be like to have patience in your body, what your body would feel like, what your face would feel like, what your thoughts would be like. And we would magnify that in your imagination so that you fill yourself with that sensation and feeling that comes along with patience. And you get to build up that experience of having patience in that stressful situation and then addressing the stressful situation. Evocative imagery on the Anxiety Relief CD or best quality imagery in the Worry Solution CD or programs. It's a very, very powerful technique, and I'm sure that it will help you. I tried to get up when I can't sleep, and most times I don't get sleepy. And when I tried 2 or 3 times, hours have gone by and get no sleep at all. What do you suggest to do to help get sleepy? And how long does one have to try this? 2 nights without sleep can make you insane. Marlon Friel. Well, we often do feel that way. People get very scared when they don't sleep. And again, this is one of those situations where your own thoughts can be your worst enemy. It's kind of the rule rather than the exception. When people get up at night and they're not sleeping, the default position of the mind goes to, oh my God, I'm not sleeping. I'm going to be a wreck in the morning. I'm going to be a wreck all day. I'm not going to be able to function. I'm going to go insane. Of course, if you think of those as suggestions to yourself, not just thoughts, that's exactly the opposite of what you want to do. You want to reassure yourself that you can sleep, that you can learn how to sleep again. And there are many things that can help you do that. One is called sleep hygiene. On my Natural Restful Sleep audio, which you can download, I talk about sleep hygiene. You can read about this. We have tips for you on my YouTube channel. These are things you've read about a lot, getting exercise, cutting out caffeinated beverages, cutting out alcohol before sleep, not staying busy with the mind right up to sleep time, turning off the screens, turning off the computer, turning off the television, taking a hot bath, sometimes with Epsom salts or bath salts, about an hour, hour and a half before you go to sleep, sends a very strong message to your body and brain that it's time to start shutting down, giving yourself quiet time, writing a list of things you need to do tomorrow about an hour or 2 before you go to sleep so that it's not constantly on your mind, making sure you get some exercise during the day. All those things set you up. Having a regular bedtime and regular eating times, all those things set you up for having better sleep. And then also learning the breathing, the relaxation, the guided imagery techniques. I've got several audios on that Natural Restful Sleep audio that are full of good suggestions to help you at least rest, so that if you're not sleeping, you're resting during the night and you're recharging and replenishing your energy reserves. Of course, if this becomes a chronic problem, you want to make sure that you get checked out medically and that you don't have a thyroid problem or some other reason that your body is staying amped up. If you have an anxiety disorder, you want to make sure, if the self-help techniques aren't sufficient that you get help for that anxiety disorder, which can range from nutritional supplementation with things like magnesium and other supplements that may be helpful to you. You may need to consult a physician or health professional that is expert with nutritional approaches to anxiety and sleep, or your medical doctor, again, to make sure you don't have conditions that are leading to this, or possibly pharmaceuticals that can help regulate your daily rhythms, including your sleep. So I wish you luck, but getting anxious and freaking out at night and catastrophizing, going to the worst, is not your friend. There's many other options, and I would encourage you to seek out lots of information that's on the web, and also to give the Natural Restful Sleep audio a try. Thanks. Is it safe to use guided imagery for everyone? Are there people who are not allowed to use them? So it's not that they're not allowed to use guided imagery, but there are people who need to be careful with guided imagery. Guided imagery is very effective. It's a very rapid way to relaxation, a rapid way to insight, to learning about yourself. And so for people who are really, really overwhelmed with emotion to the point that they've had a mental breakdown or a nervous breakdown, been hospitalized for mental illness, have a tendency towards mania, or whose mental health is very fragile, those are situations where it's best to work with a professional who's trained in guided imagery. So if you have trouble, sometimes or always, telling the difference between your mental world, your inside imaginary world, and the outside world that you live in, if those boundaries are too blurred, then guided imagery can allow emotions to come up that are going to be strong and blur that line even more. So if you're on antipsychotic medications, if you have periods of hallucinations or delusions, or you've had psychotic breaks, or had to be hospitalized or in intensive psychiatric treatment for not being able to tell the difference between your inner world and your outer world, those are places to be careful with guided imagery. So for most people, it's very safe and very effective. If you have those kinds of mental health issues, you're better off working with a professional. So if you like this question and answer format, if you got any help from this, please add a like and subscribe to this channel so that you're getting more valuable information on mental health, on stress and anxiety relief, how to use your mind to help stimulate healing in your body, change health behaviors for the better. And I will be recording these question and answer videos from time to time. So please leave your questions in the comments, and in the future I'll respond in those. This is Dr. Marty Rossman thanking you for your participation and inviting you to visit thehealingmind.org to look at all of the mind-body health resources we have there. Thanks.